Dear Dr. Makhamov, as the Neurotrauma Treatment Simulation Center reaches its third edition, we are glad you join us in the pursuit of improving multidisciplinary neurotrauma management. This annual event showcases our ongoing commitment to advancing the field of neurotrauma management through immersive learning experiences and collaboration, bringing together participants from various backgrounds and countries. We would like to ask you a few questions about your perspective on the NTSC program and about multidisciplinary neurotrauma management. So, firstly, what is your role in your delegation, your background and focus in your practice, and how does your expertise impact your perspective on neurotrauma management?
So my role is in our delegation. I'm a head of neurosurgery team in my hospital. So I'm working in the Republican Research Center of Emergency Medicine. All the neurotrauma cases is concentrating in our clinic. So the number of the cases in each year is around 3,000 and around 250-300 cases with the severe trauma brain injuries, and this is the main gap, the treatment and the multidisciplinary approach to these cases are the main gap of our dailies now, and what we seeing in perspective. So we want to make the multidisciplinary approach, so to think all the team in one direction. So the neurologist, maybe ICU doctors, a neurosurgeon shouldn't think separately. They should think in one direction. They should think quite very how to say in similar way to treat the patient, and we see it in perspective in the NTC course. So we want to take a look on how it's working in pre-hospital period. So how the helicopter team working, how the pre-hospital team working, and the rehab how is working. So nowadays we use the guidelines for brain trauma. So we treat the cases by the brain trauma guidelines. But the problems in our country, like pre-hospital how to transfer the cases, and the rehabilitation therapy after the severe brain trauma is the big problems in our country, and we want to take a look, we want to learn, we want to organize in our country for perspective neurotrauma courses to teach other clinics, other teams, to build a big sociality to develop the neurotrauma.
Right, so that partly answers my second question, which is as NTSC aims to change the treatment paradigm from short-term focus to long-term follow-up, we were looking into country and institution-specific limitations and strengths in neurotrauma management. You mentioned some limitations, but do you think there are some specific strengths that other countries might learn from, or other institutions?
So the specific what we can share with the other institutions. So we start to use the sternotomy for the severe brain trauma in its neurosurgical field. So it's very quite helping to preserve the life of the cases. So that it decreased the rate of the mortality after the severe trauma. As you know, the severe traumas mortality rate after severe trauma is very high. So the sternotomy help, and hope we will share with our presentation, with our clinical case, how we're doing it, and what we are reaching from this. So mainly we are learning in this course. So for example, when I first time attended this course, our team was working separately. Nowadays in our country we start to work together to develop it.
So what you consider to be an effective multidisciplinary team when treating neurotrauma cases? What specialists do you think should be involved?
I think it should be involved the pre-hospital team, pre-hospital doctors, or maybe paramedics. So I think it should be more involved with the rehab people, neurologists, who will be interested in a field of the rehabilitation of the cases after severe trauma. So maybe the neurosurgeon and the ICU team maybe will find one opinion, but it's very difficult to work. The neurosurgeon and neurologist, we are thinking quite separately, very differently. So we think that from the position of the neurosurgeon, and the neurologist is thinking more than in position of the neurologist, because some of neurologists never have seen the brain and never seen how a brain swelling. So we daily seeing this, and for us we in completely different thinking, except the neurologist. So I think when the teams are coming to learn, the teams should involve all the specialists, neurologists, neuro-ICU doctor, and of course the administration people, because the administration people should look how it works, because it's very easy to explain to them how it, when they will see how it works, like this NTC course. So it's more easier to work with the administration to develop this in our countries.
Okay, and what you already mentioned some, but what lessons or what skills, maybe more on that side, do you wish to gain from NTSC as a program?
Teamwork, more and teamwork, yeah. As one family, one organism, like should work. The system that the multidisciplinary approach, it means that we should work like one organism. So it's very difficult sometimes, and I think for me more interesting how it works, teamwork, how team works, how when the neurosurgeon gives patient to neurologist, when the neurologist will accept that, and the neurologist should know when the patient can have a complication of the patient in long-term follow-up. So for short-term follow-up, we will see our complications. So, but in long-term, there can be some complication of TBI. So the neurologist should know how to respond to this, and this is teamwork. So for us, more interesting teamwork, pre-hospital, and the rehab, how it works.
All right, thank you very much for the interview.
Thank you.